Okay, thanks for your interest in EEG-Now. We're going to give you a little quick start guide on how to get the cap on. We recommend that you carefully follow the placement instructions that are inside each box as well. First thing you'll do is look at the box and determine whether you want to use a male or female cap and get that cap. Then when you pull the cap out, you'll notice that there's red sealers on the inside. Just twist those off. There may be some fluid in them. That's perfectly okay. That's just normal saline. Once you get all those off, you want to look for your red arrow in the front. That's going to go right over your nose. What I like to do is put my hands together right underneath the red arrow on the inside of the cap and stretch it out a lot. Then go over to the forehead and just put it on like that. So, now we got that positioned very well. You'll notice that the front two leads are slightly different than the other leads. These are stick-on leads. What you want to do with this is take the cotton swabs that are in the accessory bag that comes with the product, and then just pull the edge of this up, and you'll see some tape here, a little tape tab. Pull that tab off. Okay. Then what you want to do is take one of the cotton swabs, use the gelled end, and scrub kind of light to moderate circular motion, and actually just stick that metal part of the electrode with no hair underneath it right into that area on the front of the scalp. And you'll be doing the same thing on the other lead. You have to get this tape off, obviously. Take your other cotton swab. You're going to pull the tab, get the tape off, get underneath this lead, make sure you have no hair, do a little bit of light to moderate circular scrubbing, get your lead into there, you're ready to go in the front. Press those down a little. So on the rest of the cap, you want to pull down a little on the sides, and on the back, you want to make sure your ears are outside the cap. Then you want to put your chin strap around, and this should go fairly tightly. Okay. Now you're ready to press down on each lead for about 5 seconds. You can do 2 at a time and wiggle them a little bit and just hold them down with moderate pressure. Same thing on all the leads. Now, while you're doing that, you want to look for any leads that could be tilted. For instance, if this one came in like that, you want to pull back on it and make sure it ends up perpendicular to the scalp. That's very important for maintaining the best contact. Here's another example here where you can see that one tilted. Push that back, get it perpendicular to the scalp, then press down on it. So once you get all those done, you're ready to connect your cap cable to your universal adapter cable. It'll already be pre-plugged into your EEG head box. Just look for the 2 blue dots here, and you have 2 thumb screws. Get that on firmly, tighten down both of your thumb screws all the way. Okay, now you've got an EEG recording going for your patient, and that could make a real important difference in their outcome, and you were the one that was able to do it.